Well, I'm really pleased to have with us today Miss Rachel Burns. She's our chief dietitian at the Blumenthal Cancer Center. Nutrition is such an important component of treatment and of chemotherapy, and also a challenging component. So I've asked her here today to answer some of the common questions that get asked by patients who are about to undergo chemotherapy. And Rachel, one of the questions I often hear is, what should patients eat during treatment or chemotherapy?
Usually I recommend overall a healthy diet. I like them to try to choose plant-based foods, which would be like fresh fruits and vegetables, complex carbohydrates versus simple carbohydrates. And the complex carbohydrates are going to be more of those fresh fruits and vegetables. It's whole wheat bread, whole wheat pasta versus white bread or white rice. Mm-hmm. I also like to recommend lean protein, which is going to help to give them energy. Lean proteins would be more like turkey, fish, chicken, legumes, nuts, and seeds. And finally, I want them to make sure that they're doing healthy fats, which is typically going to be like canola oil, olive oil, or the omega-3s. Now, sometimes during treatment, certain side effects do take place, and so patients need to deviate away from that healthy diet. So an example I always give them is if their appetite's decreased, they're losing weight, and I said to watch us trying to do more of the good fats versus the bad fats, but they may actually need to do ice cream because that might be more of a comfort food for them.
Mm-hmm. Sure. I know it is for me. What would a patient do if their appetite does decrease during treatment?
Usually we want to try to think about doing like 4 to 6 small meals a day, something in their mouth every few hours. Always want to try to incorporate some form of protein, just a couple items every few hours, incorporating that protein. Try to do just sips of liquids when they are eating, and then do more of the fluids in between their meals because they're going to tend to get filled up quickly. Having easy things available to them so that they can just kind of grab it and eat it, because as soon as that appetite comes on is as soon as it can leave. Easy things might be like instant oatmeal, a pudding, a yogurt, a boiled egg, just something they can kind of grab and eat.
What are you mentioned protein as being an important part of the picture. What are some good sources of protein, of food that have a lot of protein that patients might focus upon?
We like them to try to do the lean proteins, which would be more of like your chicken, your fish, and your turkey. Eggs are also good, or egg whites, and then your dairy products. And then those patients that don't overall need a lot of the calories, I like the dairy products because you can still get the same amount of protein in like low-fat yogurt or non-fat yogurt versus whole yogurt. So the dairy products tend to be pretty good. And right now I'm tending to like Greek yogurt. That's a little bit more protein versus your regular yogurt. And then your legumes, your nuts, and your seeds. Those are typically going to be good sources of protein. Peanut butter. It's going to help to give you that energy to fight the fatigue.
And I know it's challenging during chemotherapy sometimes to, as you said, eat that broad spectrum of foods, and we'll also give patients recommendations for foods to eat after their diagnosis and after their intensive treatment during the sort of observational phase of their therapies also, in many cases. Sometimes we've talked about blood counts earlier in the video and how that can be challenging during chemotherapy. Is there anything that patients can do nutritionally in that regard?
Unfortunately, a lot of patients want a magic bullet for that food will bring up their blood counts, and there isn't anything set in stone. But overall, following that healthy diet that I talked about can always help. Also, trying to prevent weight loss, because those patients where they're having weight loss, their body is really working at that weight loss, so it's not going to have time to actually build up that healthy tissue and build up those good red blood cells and white blood cells. protein again, and iron is a big one. You're always going to find iron in your meats, but then also you want to maybe try to think about like your iron fortified cereals. And vitamin C also helps you to absorb iron. So something that I always tell patients is maybe in the morning you do like an iron fortified cereal, and most of them are, and then have a glass of orange juice or have that orange.
Great, great. How about any other dietary supplements, herbs during chemotherapy? What's your view on those?
Cancer patients, they always want to try to take an extra supplement or an herb versus food. We need to be real careful and err on the side of caution when it comes to supplements. They do not have to be FDA regulated like food. So anybody can just make a supplement and put it out there and say it's all natural. And all natural doesn't necessarily mean that it is. I really promote more on your whole foods. No antioxidant supplement can give us what a whole fruit and vegetable antioxidant can give us. So trying to shoot more for those whole foods is most important. There has been certain supplements that have shown to affect the absorption of chemotherapy, and some of them may be forms of vitamin E, certain forms of vitamin C, ginkgo biloba, ginseng. St. John's wort is another big one, and black cohosh. So during treatment, it's those particular supplements, and those are just to name a few that I definitely don't want patients to do because they have been shown that they can affect that absorption.
I think it's really important. Sometimes when patients list their medicines, they don't think of these herbs as medicines and don't necessarily remember to tell their doctor about them. So it's important for them to list everything they're doing in that regard so that the doctor can assess the perhaps negative effects it may have on chemotherapy metabolism or absorption, as you say.
Definitely.
Great. Well, Rachel, you've mentioned some of the challenges patients may have with their appetite during chemotherapy. Conversely, there are some patients who get an increased appetite during chemotherapy, and unfortunately, since we sometimes do better with nausea more than fatigue, they exercise less and are at risk for gaining unnecessary weight. Do you have any thoughts on that?
I think when the patient before they start their treatment, they should ask their doctor how their weight looks for their height, if they are overweight, because there are certain patients where maybe we don't want them to gain any more weight. There have been studies that show that achieving that desirable body weight and maintaining it prevents for recurrence later on in the long run.
Well, this has been very helpful. I think patients are going to really benefit from knowing what to eat, and I think many patients are ready and able to make lifestyle changes once they've had a diagnosis like this and adopt a healthier diet. And we'll certainly get them in touch with you later on also if there's additional things they can do after the diagnosis and treatment to improve their health. So thank you for coming.
You're welcome.
Great.